We are speaking with Dr. Christina Del Busto, clinical psychologist at South Florida Integrative Medicine, and our topic is anxiety in kids. Off the bat, what's the difference between stress, worry, and anxiety?
I'm glad you started with that because I think that oftentimes you'll see these terms used interchangeably, and while they are very related, I think there are some subtle differences. And so, for example, worry is more of like that ruminative, like thought component, and then your stress is more of like the physical manifestation or the somatics in your body, and then anxiety is sort of like that umbrella term that captures both of those together.
So what are the signs that a parent can look out for to say, okay, I think my child might be suffering from anxiety?
I think that, it varies by child and by individual concerns, but there are some commonalities. I think that, we all experience anxiety, worry, and stress, but really to what degree they're asking sort of these reassurance-seeking questions, like where they want that comfort to know everything's going to be okay. If they're constantly asking, Mom, are you sure you're going to be there? And what time did you say you were going to pick me up? And, what if this happens? And what if, that's a classic sign of anxiety. And the other, oftentimes you'll see avoidance, right? We don't like to be in situations where we don't feel good, where it makes us feel nervous or afraid. And so we try as human beings and kids in general to stay away from the situations. And so when you see avoidance and a pattern of avoidance, that could be a clear indicator of anxiety.
Is there any age at which this is a more normal? When you're really little, everything's so new and you want to know, well, what about this, Mommy? What about that, Daddy? And you ask a lot of questions. And then is there an age where they shouldn't be as concerned about those things?
Sure. I mean, there is a natural progression. And I think that also it is, it's in the kid's nature to be asking questions and thoughtful and wanting to know. I think what you're looking for is can they be calmed and reassured with what your answers are, or do they come up with another sort of like anxiety scenario, right? So if they take your answers and they're okay with it, then that's pretty common and normal. But if they're coming back at the same question every single day and that same worry, and it's again more worry like fear valence as opposed to sort of like inquisitive questions that you kind of want to try to disentangle.
So if you see these signs, then you maybe want to get an evaluation. What do you do in the evaluation? And then I know every case is different, but what do you usually do to fix the problem?
Right. Well, so the evaluation, again, it's very individualized and personalized. And we focus a lot of times, you want to get those sort of like clear like symptoms, right, for the diagnoses, but you're really focusing on what is the impairment? What is this fear or this anxiety keeping you from doing that you need to do, that you want to do? And how is it impacting your overall, daily life, your family life, and the distress you're experiencing when you're in these situations? Because that's what you want to then target in treatment. And those become your treatment goals, right? If it's that your anxiety is so much so that you can't join the baseball team because you're so worried about what others are thinking of you or because you're not going to be good enough, then that's what we're going to work on and give you tools so that you can slowly engage in the things that you want to do, but you aren't able to do because of your anxiety.
So basically you teach them it's okay, it's going to be okay.
Right. Yeah, you give them the coping tools. Right. Because oftentimes what you have is your worry thought. And until you approach that situation and you see that it is okay and it's not as scary as you think it is or as it feels, it's going to maintain that avoidance. It's going to maintain that anxiety.
Great advice, very reassuring. Dr. Christina Del Busto, a clinical psychologist with South Florida Integrative Medicine. Thank you so much.
My pleasure. Thank you.